Hi, my name is Robert Pollock, and this is the Code Black video review. So I'm just going to systematically go through the questions and answer them as need be. So I guess kind of the first thing I want to talk about is after viewing the film, it made me like kind of a little bit skeptical about healthcare because um, the current medical model that they're using, I'm assuming throughout the United States, but especially in the Los Angeles area of the private healthcare and private hospital system is very much neglecting the care of average, ordinary people who just happen to be in a bad situation financially, or people that just need extra help getting through what they're going through. Um, I guess kind of going off that, like it was a really good film. I really liked the parts showing the difference between what the old facility that was not HIPAA compliant versus the new facility, and it was very interesting to see Seabooth and what is a great place for medicine, or was a great place for medicine, be one of the least technologically advanced places that we even have in uh, even for athletic training. Like, we have computers and stuff within the majority of our facilities, and C Booth was almost nothing. It was literally doctors and nurses in the ER just working together to get this patient out. And I actually did watch it twice. I think I picked up on more things the second time watching it, and I actually kind of liked it better the second time. So um, it's just one of those that it makes you kind of really guess, um, or really critically think about our medical model that we're using, and just start to review what the balance of privacy versus accessibility is. And although um, we're very trying to be very private with patient information, where does that leave us going forward with their their uh, accessibility to healthcare professionals? One of the things that I was kind of really thinking about is just like when the one of the nurses is talking about the old C booth and how they did the mental health there, and he had to show his patient's daughter the body of their mother after to identify. And right next to the place you have people that are violently ill, and then right next to that is someone that's just psychotic, yelling every swear word in the book. And it just makes you really like kind of understand that although this is like really good, there's some other side points that like everything needs to be kind of weighed and understood. Um, in regards to some of these core competencies, kind of the professionalism aspect, I think it's very well covered. Like how professional the senior residents and the people being interviewed were. It's and with that kind of accepting, especially in the ER, that the fact that your patient may not always be alive after you've done everything that you can think of. And It's just one of those things. It's very interesting to be like, what happens and how professional can you be after the fact that you've been doing CPR for forever and the patient's not responding, and you have family members in the waiting room that, um, just needless to say, I was very amazed, and I was very grateful of how professional the senior resident that had to do that was, and it was just very, very interesting to me that I don't understand how someone can do that, and as a doc or the doctor said, I don't imagine it ever getting easy. So it's just one of the craziest. I still can't understand how much emotion has to go into both sides, you delivering the news and then also receiving the news. So I don't necessarily think this film relates 100% back to athletic training, but I think that some of the things that they talk about in there we can definitely install in an athletic training facility. Um, One of those things is kind of understanding that um, you may have a lot of patience to get kind of to move through and like maybe backed up, but like at the same point, um, and also have to document, but at the same point, any of that can turn around and like end up being a lawsuit, or you can just kind of neglect your patient basically, and they don't get their full scope of treatment. And it just really emphasized for me like using patient-centered techniques, and trying to get the patient to what they perceive they need, and really just working towards a common goal instead of this is what you need to do this because I am a healthcare provider. Overall, I think kind of, again, bringing up the whole medical model, it really calls into question like, is the current medical model the best that we can have, or is it just the best that we have at this point? In which case, it probably needs to be revised, and we need to revisit the fact that we're exacerbating the socioeconomic landscape and not allowing everybody equal opportunity, or equal opportunity to healthcare that they need. And it needs to be revised, or at least thought of in a way that we can make it more accessible even with our current privacy standards. So that is my review of the Code Black movie. All in all, I'd definitely watch it again, and I would definitely recommend it to anybody that's interested in medicine. Robert Pollock signing off.